If you're a man over 60 and have experienced erectile dysfunction, you're far from alone. In fact, erectile dysfunction, often called ED, is one of the most common health concerns affecting older men. Yet many men suffer in silence because they feel embarrassed or assume it's simply a normal part of aging. Today we're discussing how common ED really is, why it happens, and the treatment options available today. The good news is that many men can find effective solutions and continue enjoying healthy, fulfilling relationships well into their later years. How common is erectile dysfunction? The numbers may surprise you. One of the most well-known studies on erectile dysfunction found that approximately 52% of men between ages 40 and 70 experienced some degree of ED. Research and clinical data consistently show that erectile dysfunction becomes more common with age. Many experts estimate that roughly half of men in their 60s experience some level of erectile dysfunction, while rates continue to increase into the 70s and beyond. The important thing to remember is this: what causes ED after 60? An erection depends on healthy blood vessels, nerves, hormones, and brain signals all working together. As men age, several factors can interfere with this process. Common causes include reduced blood flow, heart disease, high blood pressure, diabetes, obesity, certain medications, low testosterone, stress and anxiety, depression, poor sleep. In many cases, ED can actually serve as an early warning sign of cardiovascular disease. That's one reason doctors encourage men not to ignore it. Treatment. Option number 1. Lifestyle changes. For many men, improving overall health can improve erectile function. Helpful habits include regular exercise, weight management, quitting smoking, limiting alcohol, improving sleep, managing diabetes and blood pressure. Even small improvements in cardiovascular health can support better blood flow. Treatment. Option number 2. Oral medications. The most widely recognized ED treatments are prescription medications. These include sildenafil, Viagra, tadalafil, Cialis, vardenafil, avanafil. These medications help improve blood flow to the penis and are effective for many men. However, they are not appropriate for everyone and should only be used under medical supervision. Treatment option number 3. Testosterone therapy. Some men have erectile dysfunction related to low testosterone levels. In those cases, a doctor may evaluate whether testosterone replacement therapy is appropriate. Testing is important because testosterone therapy is only helpful when low testosterone is actually present. Treatment option number 4. Vacuum erection devices. Vacuum erection devices, often called penis pumps, create a vacuum around the penis that helps draw blood into erectile tissue. These devices have been used for many years and can be effective for men who cannot take ED medications or who prefer non-drug treatments. Treatment option number 5. Injections or urethral therapy. When pills don't work, physicians may recommend medications that are injected directly into the penis or delivered through the urethra. While these treatments sound intimidating, many men find them effective when other options fail. Treatment option number 6. Penile implants. For men who have not found success with other therapies, penile implants may be an option. These surgically implanted devices have high satisfaction rates among men who have exhausted other treatment options. They are typically considered only after less invasive treatments have been tried. Don't forget the emotional side. Erectile dysfunction isn't just physical. It can affect confidence, relationships, self-esteem, and emotional well-being. Stress and anxiety can also worsen ED, creating a cycle that's difficult to break. For some men, counseling or sex therapy can be an important part of treatment. When to see a doctor. You should talk with your healthcare provider if ED is becoming more frequent. Symptoms persist for several weeks or months. You have diabetes or heart disease. ED is affecting your quality of life. You're concerned about underlying health issues. Remember, ED can sometimes signal broader health problems that deserve attention. Erectile dysfunction after 60 is extremely common. You're not alone. The encouraging news is that today's treatment options are better than ever. From lifestyle improvements and medications to advanced medical therapies, many men can find a solution that works for them. The most important step is having an open conversation with your healthcare provider. Because growing older doesn't mean giving up on intimacy, confidence, or quality of life. If you found this video helpful, please give it a thumbs up and subscribe to Healthy After 60. Every week we share practical advice on healthy aging, men's health, longevity, retirement wellness, and living your best life after 60. And tell us in the comments, what men's health topic would you like us to cover next? Thanks for watching, and we'll see you in the next video.